our session this morning, and Natasha and Shea are going to come up as well this afternoon, sorry, is to talk about RBA. So who's done some RBA training? Okay, awesome. You guys can come up and take a few slides. RBA stands for Results-Based Accountability, which is basically an outcomes framework. So this afternoon, everyone, we're going to provide you with an overview of RBA and just a brief look at the RBA-related software package, which is called the Results Scorecard. Also, we're going to demonstrate how RBA and also the software package enables you to become even more outcomes-driven and also outcomes-focused. And last but not least, I'm going to invite my lovely colleagues from Te Kaha o Te Rangatahi, Natasha, Kemp and Kapa, to talk about how they've implemented RBA in practice. So, no, you thought that they were cheering for me, actually they're cheering for Natasha and Shea, but I'll take that. I just want to show you a picture of the author of RBA. His name is Mark Friedman, that's him there. If you wanted to email him, Skype him, all those types of things, he's pretty relaxed. He always wears those types of shirts. Please make a comment when you see him next or offer him some fashion advice. Okay, so why RBA, everyone? So RBA is a very powerful tool, but who amongst you are doing a bit of work in the collective impact space? Anybody doing collective impact work? Okay, awesome. So collective impact is a model that was introduced by Carney and Kramer from Stanford University, and essentially what that talks about is multiple partners working together for a common purpose. So RBA is a great enabling tool associated with collective impact, and those are some of the 5 conditions of what collective impact looks like, and you can utilise RBA to help you in that space. Again, like Inga, if you want to ask us questions during the presentation, please feel free. It's all good. Hopefully, Natasha will be able to answer those for you. So why RBA, everyone? It's also about enabling us to determine the measurable impact that we are making for clients and also for our community, and also knowing whether or not we are making that difference. So we do talk about measurable impact in RBA, and we also talk about this concept, which is turning the curve, and it's very simple. It's just a quick and easy way for us to talk about the difference that we're making, because we all want to turn the curve on a piece of data. We either want to turn the curve up or down, depending on what success looks like from a quantitative perspective. And also RBA is about bringing precision to our passion. So who wants to demonstrate that they deliver outcomes to their clients? Okay, fantastic. I can see you really want to put your hands up, but you know, it's 4:10. So RBA does enable us to bring precision to our passion around improving outcomes for clients, and when we are looking at improving outcomes and demonstrating success at a client level, we ask these 3 types of questions. How much did we do? How well did we do it? But most importantly, is anyone better off? The performance measure, is anyone better off, is exactly the same as asking the question, have we delivered client outcomes? So I'll talk about that a little bit more. So where is RBA being used around the world, everyone? It's being used quite extensively. There's heaps of people using RBA in New Zealand, and to demonstrate that, I've got a couple of logos up there, and of course Natasha's going to talk about that, but I've also got some international examples there, and you can go on to, for example, the United Way website in America, and they've got some great examples of how they're using RBA internationally as an outcomes tool. I'm not going to read through this slide because I know that after you've had a couple of wines you'll want to log on and pull up this presentation and read it through at your leisure. So I've just got here a couple of benefits associated with RBA, from being simple and logical right through to using data to drive decision making, and you'll get to see a little bit of that this afternoon. So the 3 key concepts in terms of RBA, everyone, and we're going to put them all up on the screen at the moment and just talk to them very quickly. Now this is the 101 in 10 seconds, here we go. So 3 key concepts in RBA, and I use this flow 237 from ends to means. So there's 2 types of accountability in RBA, population and performance. So when you and I talk about population accountability, we're basically talking about multiple partners sharing accountability for achieving results or outcomes for a whole population. So a whole population could be all rangatahi in the north, or all children in Tauranga, or the community of Hamilton. Okay, that's a population of people, as you'll know. And also, at a population outcomes or results level, we use indicators, and indicators are simply pieces of data which enable us to measure whether or not population outcomes are occurring. The other type of accountability, everyone, is called performance accountability, and this is where the rubber really hits the road, because this is about client outcomes. And when we talk about performance accountability, everyone, we are talking about high-performing NGOs, high-performing agencies like yourselves, holding accountability for delivering outcomes to your clients. There's also this concept 3, so we've done the 2, now we're on to the 3 types of performance measures. And when we're looking at designing performance measures to tell us whether or not your program, service or initiative is really rocking it, we use 3 types of performance measures, and they are how much did we do, how well did we do it, but most importantly, is anyone better off? Is anyone better off equals your client outcomes. How much did we do is really about the amount of effort we put into things, and that's where most of your contracts live at the moment. How much did we do? So they're counting a lot of stuff. How well did we do it is about the quality of your work, and is anyone better off as a performance measure about client outcomes. And 7 questions, everyone. 7 questions which take us from ends to means. So in RBA, what we do is we focus on the end, and then we work out how we're going to get there. So there's 2 types of ends conversations in here. There's the population outcome end as an end, and there's also the client outcome as an end. And we also talk about baselines and turning the curve. So turning the curve is when we're looking at a piece of data and we really want to drive performance improvement. Turning the curve is either up or down depending on which way we want that data curve to go. And also baseline is basically just the data graph. So here's a baseline, everyone, which you all know well, and in RBA what we do is we talk about, as I said, turning the curve. And there's a lot of kōrero, a lot of conversation at the moment about things like value for money, social return on investment, return on investment. In this particular slide, any turn of the curve we suggest is a return on investment. If you wanted to quantify that from a fiscal point of view, of course you could, but in this context today, I'm just talking about an outcome is a return on investment. And last but not least, everyone, I want to talk about the linkage between population and performance accountability. So I'm just going to bring the 2 types of frameworks up. So let's say, for example, everyone, we've got a population accountability framework, and a high-level outcome is youth in New Zealand are safe, succeeding and leaders. So a high-level aspirational outcome of well-being associated with a defined population. And there are 2 indicators here. One might be the STI rate and another might be NCEA attainment rates, right? So that's great. There's multiple partners sharing accountability in this space to achieve outcomes for youth in New Zealand. Then we've got an organisation at service delivery level, and in this particular example could be Te Kaha delivering a sexual health program. And when we're looking at organisations or agencies that deliver services to clients, we're in performance accountability land. And we use those 3 types of performance measures to understand whether or not our service program or initiative is really making a difference. And they are how much did we do, how well did we do it, but most importantly, are our clients better off? And in this case, it might be a skills and knowledge outcome, so the number and percentage of increased knowledge about contraception, for example. And that's fantastic too. So you've got a client outcomes framework here, you've got a population outcomes framework here, but the most important question is how do these 2 frameworks link together? So I'm going to talk to you about 3 linkages, and the first one is called a contribution linkage. And basically what we're suggesting is that high-performing NGOs and agencies are really rocking it and delivering outcomes to clients. They are contributing to achieving outcomes for an associated population. Okay, because client populations are simply subsets of whole populations. So what we're doing is acknowledging the fact that there is a relationship between population outcomes and client outcomes. And also there's an alignment of measures here, so we've got performance measures in the sexual health space, and we've also got indicators in that space as well. So there's an alignment of measures, it's just that the audience that the measure is relating to and the scale of that data is different. And finally, appropriate responsibility, which is a really important point. And what we suggest in RBA is that at a population level, it is about multiple partners sharing accountability for delivering outcomes to a population. Whereas at a client level, it is about high-performing NGOs and agencies, for example, really demonstrating that they're delivering outcomes to their clients. So in terms of responsibility and accountability, we make a distinction at population and performance levels, but knowing that you can demonstrate outcomes and success at both. So how is RBA being used internationally? How does it enable collaborations in using the software? So I'll just quickly go to that space. So what's really fantastic is that up in Kapa, and we can all acknowledge some of the issues that are going on up there, government agencies, the community, providers have all come together to do some collective work. And what they're doing is they're using two frameworks to help assist that process, collective impact and RBA. And what happened was that probably about 6-7 months ago, 1,600 community members all got together and we nutted out with a group of NGO, agency and community leaders a population outcome framework. And this is the result of that work. So as you can see, the population is the community of Kapa and surrounding areas, and there are 5 high-level population outcomes that multiple stakeholders have enrolled into. So our community is culturally strong, rich and proud, right through to healthy and well. And these are examples of indicators that the community have chosen as proxy indicators for these population outcomes. Okay? So some work is occurring now to look at the relationship between performance accountability and population. I don't have time to go into it today, but there is an experience or a statement or description associated with population outcomes, but we can share some of that information later on. Now I want to just talk about the software one because this is an IT session. So I thought, I better sneak something in here. There is a piece of software that enables you to use RBA and to practice RBA across at a population level and at a performance. But I do have to say that you don't have to use the software to practice RBA, okay? It is just it is a tool and it is a supportive tool. So what is it? It's cloud-based, it's specific to RBA, and what it enables you to do is e-reporting. So for example, all the whānau order collectives throughout New Zealand are e-reporting to Te Puni Kōpiri over the last 12-month period, which is fantastic, right? So there's no more paper-based reporting, which is great. Shared accountability, so you can use the software to share accountability in terms of reporting on performance measures, e.g. client outcomes and also population outcomes. You can use it for performance improvement, shared action planning, and I'll talk to that in a minute. You can demonstrate client outcomes and also your contribution to community outcomes. And it's called the results scorecard, and we'll give you a little bit of a demo. I just wanted to share this use of the results scorecard with you. So if we just go to the first window, please. So the Department of Health in Vermont are using the results scorecard and RBA to demonstrate success at population and performance levels. So population outcomes and client outcomes. And what they've done is created a network of online scorecards, and they're using those scorecards to demonstrate success. So if I just get you to click on that planning dashboard, which is the second window, and when you click on the software, what you can do is it brings up those turn the curve conversations. So this is an example. So there's a population outcome here. So I don't know how to say that, Vermonters have intended pregnancies, and then there are some indicators in that space, so the percentage of pregnancies that are planned, and you can see through the software that there are percentages there, and the curve over the last reporting period is turning down. And also you've got some information there, data there around performance measures linked to client outcomes. So that Natasha's going to give you a more in-depth demonstration of the scorecard moving forward. So let's go back to the presentation. I can see the enthusiasm on your faces, so I better hurry up so you can actually see how it works in practice. So we'll just go back to our presentation, please. And while I'm waiting, I've got another joke. Yeah, I knew that would get a reaction. So I'll just get you to just go back up, please. Where's Nora? Is Nora here? Oh, no. Hello. Nice to see you. Okay, cool. So it is just an example, everyone, of what can be used in terms of the software across a whole community. Yep, we'll just go to the next slide. Oh, yeah, I can do that, eh? I'm sorry. So how does RBA enable partners to contribute to improving sexual health outcomes for communities? So what's really fantastic about population accountability, now I'll just share a little bit of a story with you. It's quite funny, but not really. So often what happens is that I get asked to go in and facilitate these sessions with multiple partners, right? And some of these partners who are sitting around the table, they've all got the passion, you know, they really want to make a difference, but they just can't talk to each other. They keep talking past each other. And the glue just isn't there, even though they're there for the same kaupapa. So what I do is I go in and I facilitate a conversation using RBA, because what RBA does is it can create that outcomes glue from an ends perspective, and then those partners work out how they're going to achieve those ends. Okay? Because often what I see happening is that partners start talking about means, e.g., oh yeah, I do this, and oh yeah, I do this, and this is really awesome, and then the next partner will say, yeah, and I do this, and that's really awesome, and so next minute they start talking about means all the time, and then there's a bit of argy-bargy. It's a bit of argy-bargy, you know, I do it, potentially they're not saying it, but then they might be thinking, yeah, I do that better than you, and so what happens? A bit of hedge protection. And next minute, the whole multiple stakeholders getting together for a common purpose goes out the window because everyone's fighting. So I don't know about you, but you know, I've been to some of those meetings as well, and they're not good to go. So the CEO starts off going, next minute the junior from who's contracted out starts going to the meetings. So what you can do is facilitate great conversations, and you can really consolidate the common glue from an outcomes perspective, and then partners start talking to each other and not past each other, and then you're away. So part of that conversation is about the turn the curve thinking. So the turn the curve thinking is really great, because what happens is once you've understood and you've defined with your partners at either client levels or population levels what your outcomes are, then you can go through and continue talking about to each other, not past each other, what types of means you're going to collectively implement to actually turn that data curve. So there's a turn the curve thinking process. And it's not rocket science, everyone. It's stuff that you do every day. But the opportunity with RBA is to understand what the common endpoint is, and then to work collaboratively together to understand what the means are. So that's a turn the curve thinking process, and Tiao is going to give you a practical demonstration of that. Now, who's entering into a streamlined contract this year or next year? Okay, does anybody know what streamlined contracting is? No. Okay, cool. Okay, we've got one hand up there. That's good. So, streamlined contracting, that will make me sound really knowledgeable. So, streamlined contracting is a project that's being rolled out by MB, the Ministry of Business, Innovation and Employment, or as I like to say, enjoyment. So the Ministry of Business, Innovation and Enjoyment, they're rolling out this program called Streamlined Contracting. Basically what the government wants to do is it wants to streamline the contracting process, so it removes all the burden of NGOs, which you have all, shall I say, suffered, and I mean that literally, over years. Okay, so if you have multiple funders, no disrespect to funders, I love my funders, I used to work with funders and I still do. So you have multiple reporting lines, you know, you've got multiple audits, all those types of things. So streamlined contracting is designed to reduce that. So reduce compliance, reduce duplication, increase focus on outcomes. Now in the new streamlining contracting framework, RBA is in there. Okay, so I really encourage you to, if you haven't got some fluency, get some fluency in RBA, because at some stage you're going to be talking to funders, and Nari will give you the lowdown. I don't know what the Ministry of Health, Public Health project does, but I do know Ministry of Health DSS, for example, is transitioning, I think, $1 billion worth of contracts in the disability support services field over the next 8 months. So I'll leave you to Google MB and the Streamlined Contracting project to have a look at that. Now I'm going to be quiet because Takaha's the real star here, and Natasha and Tiao will come up. Awesome. So while Natasha's coming up
I'll just quickly introduce her because she's the CEO at Kapa Rangatahi Trust, an innovative Māori youth health and wellbeing provider located in South Auckland. And Natasha's worked in the health sector for the last 14 years and is acknowledged for her experience in outcomes-focused youth service delivery, community development and Māori health funding and planning.
Kia ora tātou katoa. So just to carry on from Sharon, I thought you might have just carried on because you're doing so well. So just a quick snapshot about Te Kaha. So we've been using RBA since 2010 when we became part of the Whanawara Collective Kotahitanga. So Sharon's been part of our development and our progress with RBA throughout that time. So just a snapshot about us and a little bit of kōrero about Te Kaha over the last 12 months. So we have 5 experienced trustees. We've got 12 awesome staff, but recently in a couple of weeks gone down to 10 due to some changes in the organisation. Our average age for our kaimahi are 21. That excludes me and Debs, unfortunately. For us, rangatahi are our future. They're our priority, and that we specialise in working with rangatahi. Over the last 12 months, we've been fortunate to have access and provide service to over 1,800 rangatahi. With our mama support service, because we've had a specialist clinic working with teenage parents. You can see down there, there's, do you just push the button? You can see here that these are some of the activities that we've done with our whānau. So this data that you see here is all live data from information that we've collected from rangatahi within our service. So in terms of our sexual health mahi, we've delivered services to just over 1,700 rangatahi throughout our programs, and we've delivered 133 sexual health workshops. And you can see in the little, these are the workshops that we've delivered and broken them down into the number of workshops and what workshops we've worked on. Now these workshops are all based on the need of our rangatahi, because for us it's about putting rangatahi at the centre of everything that we do. All the programs that we provide at Te Kaha are all about our rangatahi and what they want from us. So, you know, we've got set lessons, but the lessons that we deliver in either a school, a secondary, high school, or an alternate ed or in the community is all based on needs and issues of that school, high school, or alternate ed or that community. So why do we use RBA? I guess for us, RBA is our solution to making it count. And it brings to life the kaupapa and the work that we do because it tells a story. So we use the data or the evidence to tell a story about the work that we do and what's happening out there for rangatahi. It drives our performance. So when we develop surveys, when the data comes in, it actually tells us how good we are and if our rangatahi and their whānau are any better off from the service that we deliver. So for us it is about rangatahi outcomes and how we demonstrate that. So how do we use RBA? For us it is about reporting. We report monthly within our own internal service around using the RBA scorecards. But we also are now able to provide e-reporting to our funder. And I'm sure Nairi appreciates that now because we used to send in a narrative report that was like this thick. And it always bounced back, we could never get it there, it was never on time. A whole lot of problems we used to have with our reporting. But now it's all electronic. We report via the scorecard and we can now send that electronically. And we do have the ability to actually provide our funder with an access code to actually look at the data live themselves. But you know, that again, it's about how good your relationship is with your funder, whether or not you give them that kind of access. So we're developing that process. We use RBA to change the way that we work because it was all about outputs. Now it's about outcomes, and we wanted to ensure that we knew that we were making a difference. And so we've done a lot of work around changing the way that we work. And it's about support and how we share that with others. So part of a collective, part of other providers and partners that we want to work with and how we achieve better outcomes for the rangatahi that we work with. So how do we embed RBA in our organisation? where he did a lot of training, and it's training from top to bottom. And I would say actually it's bottom up now in our organisation. It's from governance, management, and on the ground with our kaimahi. Now our kaimahi are so good at RBA that it's everyday practice. We don't even think about it now. It's everything. It's an all day. We do it every day, all day. And so it's about how we share that now. It's about embedding champions within our organisation, and you're going to hear from Tia soon, who is our champion. You know, for us, it's about embedding and mentoring our rangatahi and building sustainability in a youth organisation. They're the leaders of tomorrow for us, and we need to be able to encourage them and grow them and give them the knowledge and skills to carry on these types of tools. So you'll hear from Tia shortly. And then it's a support. We've been very fortunate to have the support of Sharon, Shea and Shea and Associates, that it's, we're able to tap into her knowledge and skill on a daily basis. There's also support that you can get online from the scorecard and from the website as well. So the outcomes that we've delivered, we've looked at improved rangatahi skills and knowledge, improving attitude and opinion change, and improving behaviour change. And we've got a few examples that we've got. And Sharon's going to just introduce those examples.
We've just got two quick examples here. Natasha has got heaps. So we've got two. These are two subjective performance measures. So the data is gathered via surveys which have been tested and changed, and from a quality management perspective over time. So over the last sort of 18 months, 2 years. But this performance measure is the percentage average change in before and after scores for rangatahi who reported that they felt more positive about themselves in school environments. So you can see that over time there's been a turn in the curve, there's a slight dip at the moment, but what that does is that demonstrates, okay, so we know in what direction the data is turning, we actually want the data to turn up, so let's understand what the turn the curve thinking process is behind that to enable us to design as a team the means associated with improving the ends. So I'm just going to get Tal to talk to you about the turn the curve thinking, and I'm going to go to the our mate over here.
Kia ora koutou, ko te kapa tōku ingoa. So I'm just going to briefly go through the way that we as a team go through the story behind the curve. So each month we come together and pretty much reevaluate our scorecards, and we see from the curve what differences or what happened and how we can turn the curve up for us in this case. So some of the things could be that our peer educators are keeping on time, and so that we can thoroughly go through all our surveys or evaluations, because like Sharon said, our surveys are crucial for us, for our scorecards. So, and then other things could be the way that we organise or prepare ourselves before going into the lesson. It could be us taking our students out of their normal learning environment and taking them to our office so that our peer educators at the time can educate there. And it could also be ways around how we educate our rangatahi. So from there we go into our partners. So anyone that had any involvement with our story, that's where we put our partners. So North Coast College, for example, Wharepura Manurewa, the teachers, the peer educators, our service support coordinator. So those are the crucial people that we put into our partners. And then we go into what works. So some of the things that work is recreating our lessons or the way that our peer educators deliver. Those are some of the things that work. And then we go into our action plans. So our action plans are pretty much all internal, and the reason why is because we want to try and we don't want to fit our lessons or our students to our lesson plans. We want to try and fit our lesson plans to our students.
Yeah, so this is another example of the turn the curve. So, because telling them, they're so, in the team back there, they're so amazing, because, what doing this work does is it actually forces you to understand, okay, oh gosh, actually maybe we're not making the positive difference that we thought we were. And, it's both sweet and sour, like the kumara shouldn't really say how sweet it is, but I can say that for Te Kaha that they're really sweet because they really focus on using data to drive their decision making and also to determine whether or not they're making a difference. And so you can see in this particular one, the turn the curve is all over the place, and this particular outcome is for rangatahi who are in alt eds, and it's the percentage average change in students before and after scores who reported improved knowledge about the different types of contraception available to them. So, it does raise challenges as well as, showcasing successes. And there were some particular turn the curve thinking processes that went in behind this, and as you can see, there's a little bit more to go. Okay. All right, lessons to share. So there's just some lessons to share with you. I'll get Natasha, you can do them, Natasha, I'll just send it to you right now.
So just some lessons that we've learned along the way of using RBA and the software is that we're now in a position where we actually plan instead of just, every month guessing that we might do this, this and this and this, and then we get to the end of the month and actually it didn't work. We're now, you can see in the scorecard that there's an action plan connected to each performance measure that you have. And it really does force you to actually, have a more planned approach to the work that we do. It's about leading at all levels. So for us, it's about leading from our governance, where they support the process of RBA as part of it, as a tool that we use in Te Kaha, all the way through the organisation. It's also even around with our rangatahi, because they actually know what RBA is as well, because they become part of the RBA process when you connect with Te Kaha. You do need to identify your partners. So people that we work with, or organisations or groups, really become key to the shared responsibility of making a difference for whānau. And we're all part of making the change for knowing if our rangatahi are better off or not. It's about sharing the knowledge, internal and external. We do a lot of work internally, but also externally with our other colleagues around RBA. And it is now. We used to say it's the way of the future, but actually it's the way of now for us, and it's changing the environment that we've been working in. And especially for Māori providers, where we're always the first group of contracts or funders to be targeted, this is a key tool to use to actually show your funder, actually, we know we're making a difference. So it's about moving or being stagnant. Actually, you just got to give it a shot and move forward with it. There's a bit of work to do in the beginning, but I tell you, it's worthwhile. And it's better than staying stagnant, working in that old way that we used to, but now we're moving forward. And like Sharon said, the kumara is sweet and sour, but we don't really talk about that a lot. But we're using the scorecard and using data to drive your performance and driving the plans that you make. You really do know if your work is good or it's not. And so if it's not, it does make you accountable as a provider, as a team, to actually make those changes within your program or in your organisation to make it better. Be courageous, we say. Sometimes you just have to go ahead and go for it. So we took a leap of faith in Sharon and in RBA, actually, because, with us it is about relationships. If you don't have a good relationship with them, you won't go out and try anything. So be courageous in your walk and be courageous in the journey of taking a step into using RBA.
Okay, cool. So next steps, everyone. Just basically a couple of bullet points here. So RBA becomes a common language. So the great thing about using RBA is that we do end up having a common language about outcomes. And again, I talked about the fact that I often see a lot of partners, people within similar sectors, people across sectors who really want to work together because they're passionate about something, but they don't have a common language. And in the outcome space, when we're moving to contracting for outcomes and the streamlined contracting stuff that I talked to you about, it's really important as providers and agencies that there's a fluency in terms of the conversations that you have, particularly when outcomes-based contracting means that you're going to be more and more accountable to each other around performance in the space. So I really encourage you to get fluent in a common language. And it is across all sectors, so the streamlined contracting process, but generally, developing and delivering services with an outcomes focus is across all sectors. So for those of you who have intersectoral contracts and stuff like that, again, it's great to have a common language in that space. Accepting nothing less than growing effective organisations that actually deliver improved outcomes. I know I'm talking to the converted when I socialise that key message in this particular room, and essentially RBA is a tool that if you see value in it, I encourage you, along with Natasha, to use it moving forward. So thanks so much for putting up with us from 14 to 4.